This is the Plant Powered Challenge 2022, brought to you by Spectrum Health's Lifestyle Medicine team.
Hello, I'm Leon Hendricks with Spectrum Health. Thanks for joining us. I'll be moderating today's discussion. Lifestyle medicine, it's a specialty practice that addresses the root cause of disease, which so often is our lifestyle. As opposed to using medication or procedures to address symptoms, this program focuses on changing behaviors. More than 80% of chronic disease, we're talking diabetes, heart disease, and even cancer, is impacted by a patient's lifestyle. Success in lifestyle medicine relies on a patient's participation in their lifestyle prescription, learning to eat healthier foods, getting regular exercise, managing stress, and we know that these things, especially in conjunction, are not easy. To help patients make these lifestyle changes that really have a transformative possibility, we employ the practice of health coaches, which is why we are here today. You're going to meet some of them shortly, and we're going to learn more about what they do. We've got a great panel on tap, and we want to start with Lifestyle Medicine Practice Manager, Tibbe. Hi, Kara.
Hello. Thank you. I'm excited to be here talking about the lifestyle medicine practice and really specifically our health coaches' roles on the team. So for a lot of people, hearing the name lifestyle medicine or even health coaching can bring a lot of questions. And here on the team, we recognize that lifestyle is a key ingredient to preventing and treating disease. And when I say lifestyle, I mean kind of all of those things that really funnel into being our best and most optimal selves. So when you think about sleep, stress management, mindfulness, exercise, connection with others, and of course the big one, which is our diet, we recognize all of those things on our team and recognize that they all really work together in tandem. And that's not always easy for us to do as individuals left to our own devices. And that's where health coaches come into the mix to really partner and collaborate with our patients to help them on their journey to better health. So what exactly is a health coach? I'm sure if we asked, there would be a lot of different answers given actually we do ask our patients, and it's always kind of fun to hear what they have to say. But when we all think about the coach word and how we've all had coaches in our own lives in the past, we think of all of those people a little bit differently. Our coaches on the lifestyle medicine team are different in a great way. So health coaches are specifically trained and certified in the art and science of behavior change, which is a foundation to lifestyle medicine. We have coaches who specialize in specific areas. For example, we have 3 coaches with us today, each one with a very specific background, training, and skill set. And they work with our patients, our clients, in really highly specialized ways. Most important of those ways is understanding what the client wants for their life and long-term goals and happiness, and helping them create that positive prescription. So our coaches will never tell patients what to do. They'll really work with them to help understand what works best in the patient's life. And when I say positive prescription, I mean adding in more of what you want versus giving up or excluding things that you want to stop or eliminate. So we encourage our patients to truly focus on what they're gaining by committing to make healthier choices that work for their lives. And then we scope out what they will do instead of the previous habit that was not really adding any value for them. And by coming up with this prescription, it guides our patients to reach for their goals and ideas in a meaningful way.
All right, great. Well, let's meet the panel of coaches that we have on tap today. We want to start with Kris Rich. Kris, can you tell us a little bit more about your background, training, and what you do specifically with our Spectrum Health Lifestyle Medicine team? Hi, Kris.
Hi, good morning, Leon. I'm happy to be here today discussing health coaching and how it's an integral part of our lifestyle medicine practice here at Spectrum Health. I've been a practicing coach now for over 5 years. I first completed my training through Well Coaches School of Coaching, and then 2 years later sat for the National Board exam, and I'm proud to say I'm a nationally board certified health coach. And I also have an exercise background. So I'm a personal trainer through the National Academy of Sports Medicine, and also a cancer exercise trainer as well through the American College of Sports Medicine. And I'm able to work with people suffering from chronic illnesses and help them get stronger and live a healthier lifestyle through exercise. So I love to talk with patients about how to get more movement in their day, whether it's a purposeful exercise routine or it's just, creating more movement and getting up more throughout the day, and really understanding the importance of that and how that ties in with all of the other healthy behavior changes that they're making along the way, as well, mainly with nutrition too. The two go so hand in hand. So it's really nice to be able to take that approach with patients and have them think about exercise or movement and how important that is and how they can incorporate that through their own lifestyle. We're all different, so we all have different means of incorporating things into our lives. And so for me to help patients understand what theirs is truly meaningful to me too. And yeah, I get to work with patients in all different aspects. Taking my training and my background and putting it all together here just seemed like a really great next step for me in my career. So I'm happy to be here.
All right, we're happy to have you here, Kris. Thank you. Let's turn over to Krista Gast now. Krista is one of our coaches, but she's also a registered dietitian. But the roles actually have a little bit of a distinction, a little bit of a different purpose, each of them. Krista, can you talk a little bit more about what you do? And thanks for being here.
Yeah, hi, Leon. Thanks for having us. It's a pleasure to be here. Yes, I'm a registered dietitian. I'm also a nationally board certified health and wellness coach as well. I carry a certificate of training in adult weight management. For me, having worked so many years in both the inpatient and the outpatient settings at the hospital, I see lifestyle medicine as a true game changer in how we look at healthcare, in that it takes a really proactive approach to preventing, managing, and reversing many of our chronic diseases that our communities are facing, many of which are lifestyle related. Lifestyle medicine allows me to combine my knowledge in nutrition as a dietitian, and also my skills as a health coach, where I can lead and guide and also take a collaborative approach in supporting patients to help themselves, which is really key, because then we're putting some of that control and that power over our own health back into our own hands, which I think is really empowering to watch somebody do and just kind of be a part of that they're leading their own destiny. And that's where that health coach piece really fits in for me as a dietitian and really fills that gap to help people reach their goals.
All right, Krista, thank you. Let's turn to Libby Stern now. Libby is another one of our coaches. She focuses on tobacco treatment. Can you talk about how this fits in with lifestyle medicine?
Thank you, Leon. Yeah. So a lot of times people are surprised to hear that tobacco treatment's part of lifestyle medicine, because they tend to think of, changing diet, physical activity, and those things more so than addiction or tobacco. But tobacco and nicotine addiction is certainly a behavior and a lifestyle behavior that impacts health and can really ruin a person's health. So I'm a licensed social worker, but also a nationally certified tobacco treatment specialist. And I've worked at Spectrum Health for about 23 years, primarily in the community for many years. So in that work, I had a great opportunity to see people struggling with lifestyle behaviors and the impact that has on their life. So when I was able to move into lifestyle medicine several years ago, it was a great opportunity, because not only were we going to standardize and make more available throughout the organization and the community the tobacco treatment program, but also I have had an opportunity to develop as a health coach and work with patients that are, setting goals and making behavior change otherwise in the program. So it's been great. It's a wonderful opportunity to help people live the life they want to live and feel the way they want to feel.
Absolutely. Well, it's so nice to have so many wonderful panelists today. Our coaching team, we know that you're touching the lives of so many patients, and this is a chance to do that on a broader scale with those who are participating here in the Plant Power Challenge. Of course, it's a new year, so we imagine that many of you joining us are making some New Year's resolutions to be healthier. Of course, those resolutions oftentimes fall apart. So we want to talk with our experts about how we can get folks to really stick with their goals, how to improve their health by eating more whole plant foods. Coaches, we'd love to hear from you on this. What do you find is particularly helpful in working with patients as you deal with their desires to make changes? What can you share with our audience today as we get started with this plant-powered challenge? Kris, we'll start with you.
Sure. One of the approaches that we take with patients is to focus on what is really going well. Oftentimes, when people are making behavior changes or setting goals, it's human of us to kind of focus on things that aren't going well, or focus on the things that we, didn't go the way we planned, and then we get frustrated, right? Like, we all go to the doctor, probably once a year, and we usually hear the same things: eat better, exercise more, lose weight. So we try a bunch of different things. We have some successes, we have some setbacks, we get frustrated, repeat. So with health coaching, we get to work with our patients. One of my approaches that I take is to help them focus on what really went well, celebrate a success. It's a change is a journey, and we're going to set goals along the way, and things will go well sometimes, and sometimes they're not going to go as planned. But, even if you're thinking about, changes that you're going to make, that's also a step in the right direction. It's part of the process to even think about creating change in your life. So giving yourself credit for things that are going well, or something that you thought about, and, being ready to make a change, and recognizing that as a good step in the right direction is going to be helpful in that, overall behavior change. And, celebrating successes with other people who are also on a lifestyle change journey is really important. So that's, another great thing about lifestyle medicine and us on the coaching team. We get to connect people who are on similar journeys. I mean, everybody's different, but we're on similar journeys to live an optimal lifestyle. So our goals are individual to ourselves, but when we can connect with other people who are on similar journeys, then we know we're not alone. We don't feel isolated. Oftentimes when we're left, on our own to make choices and create change, we get down, motivation can slip, because if something doesn't go well, we tend to focus on that. Oh, it didn't go well, so I'm just going to give up. I can't do this. But when you're connected with others who are on similar journeys, and you can share maybe some of those frustrations, and we've seen groups of patients come together and encourage one another, and then that fuels their motivation again to stay on that path. So in Lifestyle Medicine Connect is one of our big pillars, and really connecting people together, like with the Plant Powered Challenge, is going to be really integral in their success down the road. So, as coaches, we love to help you recognize that, every small success is a big step in the long-term change process. So be proud of yourself for even the little things, and give yourself credit where credit is due, and it'll definitely help you stay on track.
Let's bring in Krista on this one too. Krista, what do you do to help your clients really stick to it?
Yeah, that was fantastic, Kris. Could not agree more with you. One of my favorite quotes that I came across a couple of years ago is, human beings do not resist change, they resist being changed, right? We don't like to be changed by somebody else. I know I don't like to be changed by somebody else. I want a little bit of control over what my destiny is. I feel this is really important, especially when we're coaching, but also to remember in a lot of areas of our life, whether we just decided we want to begin a journey, or we want to make a change in our life and we're already on that journey. More often than not, we start to hit that point where we feel stuck, where we get frustrated, and we feel like our current behaviors are not necessarily in alignment with our goals, where we want to be. And this can lead to a lot of frustration. Sometimes it could throw us off course. When this happens, I like to kind of explore this, right? Sometimes we get frustrated. We want to just throw in the towel and say, forget it. This is too tough, or this is too difficult for me. But I like to dive in and explore, because I think that's really a point at which we're kind of flip-flopping back and forth. We want to change, but maybe there's just some things that are getting in our way, or some things we haven't thought about yet. And so I like to have folks consider the pros and cons of changing. So kind of weighing out these pros and cons, and ask yourself a few questions. And I like to have people just ask, and I do this with myself even, ask yourself these questions. What are the benefits if I just stay the same and I don't change at all right now? What are the benefits to me for that? What are my concerns if I do stay the same? What worries me about that? What are my concerns if I do make a change? And what are the benefits of making a change? And that's really that point at which we can see some really powerful motivators often when we look at those benefits of making a change and weigh them against those benefits if we stay the same. I like to list out as many reasons as I possibly can. I sit down and I do this with myself actually quite often. I find it really helpful. It helps me visualize and acknowledge where I am versus where I want to go, where I want to be, or sometimes just how my current behavior is not moving me towards my desired goal or my vision that I have for myself in whatever area of my life. So this can help us discover how or why we want to make a change. And then always remembering, I said earlier that we are in charge of deciding if it's worth it for us to change. Is it worth it? Instead of someone saying you must change right now. And I think Kara mentioned this earlier, is we don't tell people what to do. We help guide them towards what it is they desire, where they want to be, and why is that important to them.
Mm-hmm. Let's bring in Libby on this one. Libby, I come to you. I've got this New Year's resolution, and I want it to last longer than January.
Right. Well, I agree with you, Krista and Kris, both of you providing wonderful information about coaching. So true particularly in my field with tobacco treatment, but I think it is true across the board with many of our patients. When we start to work with them, oftentimes they really are feeling defeated. They feel like, I've tried to do this unsuccessfully over and over. And so I don't know if I can do it. They have a lot of doubts and really struggle with that. So one thing that I really strive to do is to help them find, those successes, but also to really help them find their why for changing, right? So we have motivations, maybe our spouse wants us to change, or our doctor's telling us to change, but we really have to find within ourselves why that matters. I want to live longer, I want to be healthier, but why is that? So we do a lot of exploration around that, because I think when people really have, when they find that and it aligns, with our values, it's important to us, and it's really heartfelt. So when folks find that, it makes it easier to keep that in mind as they start implementing change. The tool what Krista mentioned too about looking at the pros and the cons, we do that a lot. And also with folks when they're making behavior change, it's helpful to, I'm going to change my behavior, but what am I going to do instead? So with patients, having them identify those kind of troubling routines or difficult routines that they need to change up for success, really finding some alternatives to that. So, and instead of doing this one behavior, maybe, it can be any sort of thing. If you're having for instance, you're having heavily sugared beverages, or you're doing things that are impacting your health and that you want to change, identifying, well, what could I do instead? Maybe instead of having coffee with creamer and sugar in the morning, maybe I could have a peppermint tea, or maybe, finding something and making a list, creating a list. Instead of this, I'm going to do that. And again, when they have those small successes, that's huge. It really lays the groundwork for them. So I do that too. I encourage people to give themselves credit. Again, if you're coming from feeling unsuccessful and feeling like, I can't do this, I can't get this right, changing that up and not only utilizing the support of the group, but supporting yourself, giving yourself some positive messages, giving yourself some grace are really valuable too. So that seems to be something that a lot of people deal with. We all deal with. So, yeah.
All right, Libby, thanks. These have been wonderful suggestions from all of you. Thank you all for your insight there. Many of the people watching now are embarking on a 30-day challenge. I want to give you all a chance to kind of make this personal for yourselves, and hopefully many of the people in our audience will be able to relate. I'm curious about your personal plant-powered experiences. What are the challenges, the speed bumps you hit? How do you stay on course? What are some of the tips and tricks to getting back on course when you have that temptation to fall off the wagon? Kris, we'll start with you again.
Yeah, so I mean, we mentioned the word journey throughout this whole panel discussion so far, and my own individual journey has been quite a ride. I grew up on budget meals. Maybe a lot of people on the Plant Powered Challenge are in that similar boat, right? Like I had a lot of Hamburger Helper and spaghetti and sloppy joes, hot dogs, things like that, are budget friendly and quick and easy to make for busy families. So, I mean, my mentality has grown a lot, and I've learned so much and on this journey as well. The exercise piece and being active never was too much of a challenge for me. But, in high school, we focused on nutrition was more so like, playing sports and being active. You think I need some protein, I need more protein, I need less carbs. So, having that mentality and then coming into lifestyle medicine and learning, about whole foods and how that really does help me grow and be stronger was a concept to me that I still continue to learn. We have a wealth of knowledge on our team. Krista has taught me a lot about nutrition and along the way. So when I think about whole foods and trying to make changes on my own, and by no means am I perfect. I mean, I still struggle in certain areas, especially around this time of year too, and post holiday season and trying to make some changes. We think, I've been motivated to just kind of hit the ground running and let's go. I can do this. And then halfway through January, I'm like, oh, I don't know that, what am I doing wrong here? So again, like bringing in some of those behavior change techniques we've been talking about all morning. When it comes to nutrition, one of the things that I think about when I'm making choices are the words minimally processed. So, we know that whole foods or foods as grown are the least processed foods that we can enjoy. So, when making my grocery shopping list or picking out my recipes for the week, I try to just think about those words, like minimally processed. So where can I make those decisions where, I'm eating more whole foods and less of the processed stuff? So that's, again, that concept of like bringing in more things rather than I can't have, or I shouldn't have, or I can't have this or that. I know that I'm in control of my own decisions, and I can really have what I want, what sounds good. But if my goals are ultimately to lose weight or to lower my cholesterol, then, I think more of like, what can I bring in that, to really help me with that? So minimally processed are the words that, just kind of ring in my brain as, helping me make better decisions with nutrition.
All right, Krista, tell us a little bit about your journey.
Yeah, so as a dietitian, you'd probably assume that I've eaten this way for many years, right? That's not the case. As a dietitian, I'm going to date myself here, but in college in the early 90s, nutrition was had a different look. Nutrition science had a different look. And what I learned and what I was taught is very different than what I have learned over the course of my career. And coming to lifestyle medicine really was an eye-opener for me as far as truly the power that food has over reversing disease, even in a lot of cases. It's so powerful. And I always knew that eating our plant foods are really great, but it's how much should I do? Should I do this all the way? And that was kind of staring me in the face when I joined the team a little over 4 years ago. And we launched the first plant powered challenge shortly after I joined. And so I was really early into my journey with moving towards more of a whole plant food diet. And so for me personally, what works for me is started to take slow steps. I gradually just started adding in more plant foods. I made small changes and swaps. And I think, Libby, you did a fantastic job of kind of describing in my mind what I even did in my journey is those small swaps. And so, for example, the first thing I did was I started adding vegetables and I started adding lentils to my egg breakfast. I used to eat eggs several times a week and getting my protein in, right? And so I started just kind of adding veggies and lentils to that. And then eventually I started scooching out room for the eggs because I was getting satisfied with adding some of those fantastic plant foods to my plate. So I just had started to basically crowd the eggs off my plate and make more room for the plants. But it was a process. It took me time. It wasn't something that happened overnight for me. And so, for some people that works really great. They jump in full force and that's great. But for a lot of us, it's those small changes over time. And each step we take, the more plants that we add in, and this is something that I experienced was a motivator for me, was I started to feel better. And so that was a big, powerful one for me. Like, wow, I'm feeling so much better. I'm going to continue to do this. I'm going to continue to add these plant foods to my plate. So for me, it's about progress rather than perfection. I think we can get mired down in feeling like we have to be perfect about this, and that can be really frustrating. It can be overwhelming too, to feel like we need to be perfect about something. So if we're making progress and we're adding those plant foods, fantastic. That's a win. I think the great thing about this plant powered challenge, this 30 days, is that it's truly for everybody. So regardless of where you're at right now in your health journey, just learning to eat more plants, whether you're adding fruits or vegetables just a few times a week, or you're fully transitioning to a whole plant food pattern of eating, you're going to get a substantial benefit with your health just by making more room for them on your plate. You're going to start to feel better, and let that be your guide as to what your body is really telling you, because we tend to tune our body out, don't we? We don't listen, and it's there to tell us kind of our cues if we just take the time to listen to it and be open.
All right, let's turn it over to Libby now for some of her pointers. Libby, what are some of the roadblocks that you see in your personal experience, and really, how do you keep on track yourself?
Thank you. When I joined lifestyle medicine about 2 years ago in 2019, I really knew very little about the whole approach of lifestyle medicine. And really, I thought at that time that I had a fairly healthy diet. What I didn't realize is that a lot of the things that I was eating really had added sugar, kind of hidden sugars, hidden salts, or preservatives that I didn't even know were there. So they were much more processed than I was aware of. And the whole food plant-based, I just wasn't familiar with that. So it was eye-opening for me. And over time, I've learned so much in lifestyle medicine from Krista and from everybody. Honestly, we have great programs, and it's so informative, and in a way, I think once we get used to it, it's very simple and easy to follow. So I started making some small changes by adding more whole foods and more plants, similarly to what Krista described, not focusing so much on not eating certain foods, but just adding more of those healthy choices. And another thing I did was Lifestyle Medicine has a fasting program, and I tried that. And I really noticed after I did the fasting program that my palate started to change. So a lot of the foods that I had craved in the past lost their appeal for me. And I not only didn't crave them, but they didn't even sound good anymore. So things that I grew up on, I grew up in Georgia, and we had a lot of Southern food, and like macaroni and cheese and fried chicken, potato salad. So, things that are just, not have a lot of saturated fat and oils. And I didn't eat a lot of those before I joined Lifestyle Medicine. But now they really don't appeal. So I think that having that opportunity to change your behavior is different for everybody. Like I think Kris and Krista both said that. And it's just a great opportunity for me to coach folks and to support them in a way that's positive and doesn't have that kind of, I'm going to fix this on me, but as a partner for them. So it's a wonderful practice, and really excited about the Plant Powered Challenge.
All right, Libby. Thank you, coaches, for all of your insight and your advice. We know it's going to be helpful for folks who are going through this over the next 30 days. But of course, it's really our sincere hope that that this has a lifelong impact for those who are participating and those people with whom they share their stories and their experience with. So coaches, thank you for that. I do want to give Kara a chance now to talk a little bit more about how our audience can have access to these coaches if they want to take the next step with this. Kara?
Yeah, thank you. Our health coaches in the lifestyle medicine practice are really a package deal. So when, as a new patient, when you come into the practice, you'll have the opportunity to connect with a health coach, either one-on-one or through one of our other practice program offerings. And we have many really amazing programs through the practice that help support a patient during their journey. So all of the things that our coaches talked about today, that behavior change piece, and really helping to be a partner in health, they're there to help support patients through that. Some of those programs I'll just touch briefly on. We have a Cooking for Health appointment series where patients are actually either in their own kitchen or in our teaching kitchen at the lifestyle medicine practice, learning about how to cook healthier foods, how to include more like healthy fats in their diet, reduce sodium, and just really journey through a lot of different experiences hands-on where they're learning, getting recipes, and having that support with our registered dietitian, Krista, who's also a health coach, and then also one of our physicians. We also have, which Libby talked about, and I think many of us on the lifestyle medicine team have participated in, but we have a 2-part appointment series. It's a medical tailored fast. So the fast is monitored with a physician, and our health coach, Kris, actually leads that most of the time. So you would get the opportunity to see her during that appointment series. And then we also have medical nutrition therapy visits with Krista. We have a whole tobacco treatment program that Libby leads, which is an amazing opportunity for any patients that are trying to quit tobacco in any way. And she's just a wonderful partner to those patients for us. Please check out any of our resources on our website, Spectrum. If you go to spectrumhealth.org and search lifestyle medicine, you can find many of our practice offerings on there, as well as the culinary medicine offerings. We have an amazing Facebook support group, Spectrum Health Lifestyle Medicine on Facebook. It's just tons of individuals in the community coming together and learning more about how to integrate lifestyle medicine into their lives. And of course, anyone can call the practice at any time. You can self-refer, you can get a referral from your physician, or you can just call to get more information. And our number is 616-486-0385. And I'm sure you guys will see that posted many times throughout the Plant Powered Challenge as well. So thank you so much. We're so grateful to have this opportunity to be here and speak with you all today.
All right, Kara, Kris, Krista, Libby, thank you all so much for your insight. For our audience, we are just getting started on the Plant Power Challenge. Coming up in the next few days, we're going to take you inside the kitchen. On Friday at 8 a.m., we'll have our first cooking demonstration. We'll show you how to prepare a plant-powered breakfast. We hope to see you then.